Hello, I'm Dr. Shaylin Buck of Decatur, Georgia. I will be taking you on a tour of DeKalb Medical's LTAC and introducing you to members of its excellent care team. You may be searching for a facility like this for your loved one who is being discharged from a regular hospital or acute care facility but still requires specialized recovery care. Decatur is on the central eastern side of Atlanta and is one of the metro area's most charming places to live, work, and visit. The LTAC here on Candler Street near Commerce Drive is within walking distance of the Decatur MARTA station. You have choices when selecting a long-term acute care facility for your loved one, and we believe this hospital is exceptional because of its compassionate care, excellent patient results, and its great location. Our tour starts on the main floor where patients and families first go to be admitted. We'll meet Trish Burns, a respiratory therapist here who will help explain just what an LTAC or long-term acute care facility is.
Hey, Dr. Buck, I am Trish from Respiratory Therapy. Nice to meet you.
So Trish, what is an LTAC exactly?
An LTAC is a specialized hospital. Most of our patients come from another hospital setting where they may have been in an intensive care unit or on the floors. They need continued care and specialized care, and they come to us.
What types of specialized programs do you offer here?
We've got a lot of programs we're really proud of. Two specifically are our disease-specific ventilator weaning program and our disease-specific wound care program. We treat wounds, we wean patients from the ventilator.
Is this like a nursing home or an assisted living facility?
No, I don't want you to think this is a nursing home. It is a long-term acute care hospital. Our length of stay here is typically 20 to 30 days. We do what we do best, then our patients can either go home or to another level of care.
Moving a loved one to an LTAC can be a difficult time in a family's life, and that's why DeKalb Medical has pleasantly designed this hospital to make it welcoming for families and patients needing long stays. Let's meet with Referral Services Director Walanda Jones to talk about how the admissions process works.
Hi.
Hi, Walanda. Do you mind if I have a seat?
No, have a seat.
One of the common questions that people have is, how does a patient get a referral here?
The admission process begins with the referral from the patient's physician. The referral can be electronically sent to us, it can be faxed, or a telephone call can be made to our admissions coordinator. We have a very simple registration process here. We are prepared upon your arrival with our process of getting the paperwork completed. It will be pre-printed and waiting for you. In addition to that, our waiting room is very nice and we have free beverages for you and your family. We also have a very compassionate staff, great team of individuals who are here to assist you upon your arrival.
Does that include help with insurance?
Absolutely. We will sit down and go over your loved one's treatment plan for the length of stay that you're going to be here in our facility.
Well, that's got to be a big relief. And what about the location?
Our location in downtown Decatur offers families lots of choices. They can walk to restaurants, grocery stores, coffee shops, churches, and a great library. We also have a really good cafeteria here on our ground floor, offering healthy foods at a low cost.
The location also has a spacious parking lot and offers free parking for admitted patient families, which is a nice benefit. A smooth admissions process, this ideal location, and its distinguished amenities are great reasons to ask your physician for a referral to DeKalb Medical's LTAC. An even more important reason is the excellent medical care practiced here that includes a customized approach for each patient and begins before they even arrive. Let's hear more from one of the physicians, Dr. Terry Tenhor. Doctor, how does the team here transition the patient from their previous facility?
We have a case management team that goes to the previous facility and takes a look at the patient, their history, all of their problems, basically makes a chart. They then review that with whoever the medical director is or the attending physician for appropriateness of admission.
How does the team coordinate the patient's care once they're here?
When the patient arrives at our facility, they're initially met by the physician and nursing team. Shortly thereafter, a team of physical therapists, respiratory therapists, occupational therapists, and speech therapists will all assess the patient. Within 48 hours, the entire care team, with their various plans, sit down with the family members to detail the patient's plan of care and therapy.
What other physician specialists might provide care for a patient here?
We have an excellent team of support physicians, including infectious disease. Many of our patients have wound care or antibiotic issues, so we partner with the infectious disease specialty team. We also have pulmonary and critical care, we have neurology, we have neuropsychiatry, and even surgeons and plastic surgeons that will come help us with our patients.
As you search for long-term acute care for your loved one, it's important to compare the specialties offered at each facility. DeKalb Medical is one of the only LTACs to have a comprehensive team of specialists on staff. These specialists manage everything from intravenous antibiotics therapy to customized nutritional plans, wound care, ventilator weaning, and even an on-site pharmacy located on the main floor. Another point of pride here is the rehabilitation therapy that can help patients progress toward greater mobility and strength, even if they are on a ventilator. Lockwood Murphy, one of the specially trained physical therapists here, is waiting for us in the third-floor gym. Hi, Lockwood.
Hi, Dr. Buck. How you doing?
You're one of the licensed physical therapists here in the rehab gym. Can you tell us a little bit about what types of programs, what types of activities that you do with patients?
Yeah, well, down here in the gym, we do a lot of things. We have parallel bars where we can work on walking. We have a mat over there where we can work on just transferring from a wheelchair onto the mat. And on the mat, we can work on rolling and other activities that patients would do in bed.
So patients who are on a ventilator, can they still do rehab activities?
Here, we're Joint Commission Gold Seal certified. We can take them off the ventilators and hook them up to portable oxygen tanks, and we can bring them down here. We can bring all the equipment we need to bring to monitor their vital signs and make sure that they're safe. Do everything we would do with a patient who's not on a ventilator.
In addition to the therapy gym, the third floor houses other clinical services that many LTACs don't have on site. Minor surgical procedures like tracheotomy or tube removal are taken care of in the procedure room. Patients needing x-rays or other imaging during their stay will come to the radiology room. Now we'll move to the fifth floor to take a look at the spacious private patient rooms and nurses station that are very similar to those on the fourth floor. We'll meet Lori Lewis, Director of Outcomes and Operations.
This is where our specially trained nurses use the latest high-tech monitoring equipment over a secure Wi-Fi network to support our patients. Since many of our patients are on oxygen or on ventilators, it's important to watch them carefully for any changes. Also on the fifth floor, we have a special care unit, or an SCU, for patients who need closer monitoring. This unit has 6 beds staffed with critical care nurses.
What about the average number of patients at this LTAC?
We have the capacity for 44 patients. However, we usually stay around 30 patients here.
Now, is that typical for an LTAC?
Most LTACs have as many as 70 patients on one floor, often by using double rooms. Within the last few years, DeKalb Medical made the decision to make all patient rooms private at all 3 of its hospitals. That helps keep our patient count lower, and it's a great benefit to them.
This is one of our patient rooms.
Wow, this seems bigger than a typical patient room.
Yeah, we like to call them patient suites.
Oh, okay.
Yeah. We have the bed and the patient area here, and we set up all of our equipment here when the patient comes in. And then we have a family area here. Here we put up our nurses and our respiratory therapists and our patient care techs so that everybody knows who they are and have their phone numbers for the day. And then a little corkboard here so that everybody can put up their cards or whatever, pictures from home. And we added a new TV, a nice big TV, so the patients can see them from the bed. We have an accent wall over here, and we painted them in different colors in all the different rooms so that the patients have a little color in their rooms. All of our mattresses are specialty mattresses. All patients are on them regardless of whether they have a wound or not, and it helps with pressure relief and comfort for the patients.
Care and comfort of patients and families is of primary importance here. Both patient floors have comfortable waiting areas for family members and visitors. In addition, trained specialists facilitate monthly family support group meetings to help families have a safe place to talk with others about what they are going through. Executive Director Rich Graham has helped to set and maintain very high standards of patient and family care here, which has been recognized by many accreditation and national healthcare organizations. The LTAC's Wall of Awards is a point of pride for Graham and his staff. Hi, Rich.
Hi, Dr. Buck.
How are you?
I'm very good.
Great.
Have a seat.
Thank you. We've learned so much about your impressive facility. Thank you for sharing your staff's time with us.
Well, Dr. Buck, you're quite welcome. We are glad to have you here. You know, we are very proud of the skilled team that we have here, and we have the utmost respect and care and concern for our patients.
I understand that your hospital has received national recognitions in wound care, respiratory care, and acquired brain injury, and didn't realize that that is a unique honor to your hospital.
Yes, it is. We are very proud of those recognitions and awards, and they have distinguished us and our care from the other facilities in the area, and we stand behind those awards and deliver excellent care to our patients.
Can you remind our viewers how they or their loved ones can be admitted here?
You know, we are a referral hospital, which means you do not get directly admitted here. You have to be referred to us by your physician, your specialty physician, or another hospital. We do hope that people will consider us for their long-term acute care needs. We are committed to providing every patient with the best possible care.
Thank you for taking the time to learn about DeKalb Medical Long-Term Acute Care Hospital at downtown Decatur. For more information, please visit the website or call 404-501-6226.